My name is Dr. Archana Dhawan Bajaj. I'm a gynecologist with a special interest in infertility and IVF. Well, there's not one thing which gives me the motivation. There are a couple of things which give me the motivation. First of all, what really motivates me is that I've seen the good side of my profession. I've seen a side of my profession which has got me, awards, decoration, praise from patients. Now is the time for all of us from the healthcare fraternity to look at the bad side of this profession, to face the part of the profession where others are sitting at home and we are in the front line meeting patients every day where we don't know who has COVID, who doesn't have COVID, who is house sick, who's not house sick. So we are in a situation where we are now, this is the actual time where our generation of clinicians are facing the downside of this profession. So when I've seen the good days of my profession, I have to see the bad days of the profession as well. So that is one thing which motivates me. The other thing which really motivates me, and which is which I don't know how many people would look at this as a motivation, but I look at it as a huge motivation, is my staff. I have 40 people who work for me within the clinic, within the hospital, as my part of my team, etc. If I lay off, if I sit at home, these 40 people sit at home, and as a result their families sit at home. So I cannot afford to sit at home because of the 40 people who are looking at me for sustenance. Now I have a son, I have a daughter-in-law, I have a husband, I have a mother, I have a 75-year-old mother who lives with me, who's a practicing anesthetist. We have made her sit at home because we don't want her to be exposed because of her age. But my son, my daughter-in-law and my husband, the minute I leave home and the minute I enter back home, there is just one point agenda. आपको क्या फर्क पड़ता है, आप घर क्यों नहीं बैठते? मैं घर बैठना अफोर्ड नहीं करती हूँ because I'm answerable to so many patients who look up to me. I'm answerable to so much of my staff. Where is the question of sitting at home? I am still having to convince them. Down 3 months, the Corona saga, I'm still having to convince them every day. Every morning we start with a story. Why are you doing this? You're subjecting all of us to risk. You're subjecting Falana to risk. You're subjecting Falana to risk. But end of the day, I have to tell them and I have to convince them that there are. See, actually, perhaps my practice might be a little different from a normal obstetrician's practice, because most of my laboring girls are girls who have undergone an IVF or an IUI or some sort of a ART procedure with me. So my association with them is not really just that 9-month association. It's usually a 2-year association. When they come in for a fertility treatment, we gradually start with the basic treatment, move ahead. So I have my bonding with them is maybe 2 or 3 folds the bonding of a regular obstetrician who has a walk-in patient who gets pregnant on her own. So for me to tell a girl who's pregnant कि अब मैं नहीं देख रही हूँ तुम्हें, that is it gives a lot of insecurity to the patient. So this is where I have to start convincing my family कि मैं उसको इतने दिन से follow कर रही हूँ. She has not, she has no association to the healthcare provider except me. So that's where I have to start convincing them every day. This convincing story starts in the morning. Again, when I come back for the, after ending the day, again we have a discussion. This kind of goes on, and I guess this will continue going on. I will keep doing my work, they will keep doing their work, and that's how, eventually the Corona will come to an end. See, a lot of girls, when they go into the hospital, they go with a thought process कि पता नहीं साथ में कोई COVID तो नहीं होगा. Then you have to explain to them कि if we are going into a COVID facility, the hospital and the doctors, we are all ensuring that you are away from the COVID patients. That is the sole purpose of testing you pre-delivery, so that you are segregated. If you are a COVID positive patient, we treat you accordingly. If you are COVID negative, we ensure that you have, at least from a hospital stay or a medical perspective, you hardly ever get in contact with anybody who has COVID. So that's one thing which you have to really push into their minds, because they are petrified, and they're not petrified without a cause. Like abhi before coming to see you, I was writing admission for somebody for induction today, and she was like, मैम ऐसा तो नहीं होगा कि जो मुझे देख रहा होगा वो कोविड पॉजिटिव होगा. Fair enough, she's got a very valid point कि चलो मैं तो नेगेटिव, पेशेंट्स तो नेगेटिव, स्टाफ तो नहीं पॉजिटिव होगा. Then you have to go down, explain to them how the staff is screened, how they are quarantined if they come into contact, God forbid, with somebody. And also, obviously people are scared. And then I have also started noticing, and it's a very valid thing you've asked, the minute people go home, जब हम भी घर बेचते हैं, my sort of sending off comment to every patient is please ensure कि apart from you, your mother-in-law or your husband, or on a very downside your japa, nobody else enters the baby's room. But see, 2 people or 3 people just looking after a baby, not having much contact with outside world, वो थकेंगे भी, वो टायर्ड भी होंगे, वो थोड़े डिप्रेस भी होंगे क्योंकि कोई मिल नहीं रहा है. नॉर्मली डिलीवरी के बाद क्या होता है, दुनिया भर के लोग आते हैं, घर में हो हल्ला होता है, एक्साइटमेंट, the mother also, like, she doesn't realize the kind of superhuman effort she's putting into towards feeding, tidying, washing the baby, because there's so much of that upbeat environment in the house. That's all gone away. So a lot of girls will call up and say, ma'am, I'm feeling very depressed, I don't know how to cope. A lot of people are not getting in maids or help from outside to help because they're scared that they will not be able to sort of screen कि किसको infected है और कौन नहीं है, which also seems to be a very valid point. But then it's putting all the more pressure of looking after the baby on the parents. तो वो फिर आपस में भी झगड़ते हैं, वेयर आउट भी होते हैं, थकते भी हैं, नींद नहीं पूरी होती. ये तो बड़ा vicious circle है. And people are very demoralized sometimes. They will come and tell you, I don't think I am ready to take this phase post delivery. Yeah, I think I'm feeling depressed. Yeah, I feel I'm not कहीं मुझे postpartum depression तो नहीं, because people don't know that there is a fine line between blue and depression. So जैसे किसी को blues होने लगते हैं, उनको लगता है मुझे postpartum depression तो नहीं. It's very very valid. I would say in this situation, this kind of call I will get from 1 in 3 mothers कि मैं am not able to cope. First of all, contrary to what is just around, that corona is the biggest killer, it's going to bring the world to doom. It's not. See, if you look at the infectivity rate, look at the recovery rate, and you see how many mild and moderate cases we have, severe cases and death rates for a population like ours, if you compare to the rest of the world, we are doing fantastically. See, we are a huge population. If the world says कि हम under report कर रहे हैं, हर जगह under report हो रहा है ना. There is no universal screening barring maybe some parts of Korea and Singapore. There is no universal screening. So a country like ours is doing very well. Our people need to be confident in our government and in our healthcare system and in themselves. See, a mild and moderate disease, for all you know, हम तीनों को होके चली भी गई और हमें पता भी नहीं चलेगा. So this is something girls need to understand, that the world is not going to come to an end. And secondly, the good thing is that there has been no evidence of transplacental transmission of this virus up until this point. So pregnant mothers can be, a bit relaxed. And also, you see, like any pandemic, if it sees a peak, it's going to see a plateau, it's going to see a downfall. Soon the end is going to arrive. So it's okay. It's a bad time, but we're all in it together. See, as I said, you have to understand that this is going to eventually die its death. And secondly, it's not such a big killer. In our country, we have more losses to tuberculosis, we have more losses to diabetes, we have more losses to chronic renal disease, we have much more losses to accidents, we have much more losses to suicides, forget about everything else. So please do not, get demoralized to a point that you get into a shell, you get depressed. So many people come and tell me, I'm बहुत depressed हो गई, बाहर नहीं जा रही, अंदर नहीं आ पा रही. See, you have to understand that we have to eventually start conditioning ourselves to living like this for another 3, 4 months, 5 months, 6 months. But this is going to end. Secondly, something which has really hit my heart in this period, मैंने ये रियलाइज़ किया कि जब बाज़ार नहीं खुले थे, मॉल्स नहीं थे और सिनेमा हॉल्स नहीं थे, लाइफ फिर भी चल रही थी और ठीक चल रही थी. So it is like maybe providence or God's way of getting us back to basics, or making us realize that we can make do with little. We can make do with little finances, we can make do with little resources, we can make do with little क्या बोलो, luxuries, and we can make do with a lot more human interaction. घर में अपने घर वालों से ह्यूमन इंटरेक्शन जो कनेक्ट खत्म हो गया था ना, वो सारा धीरे धीरे वापस आने लग गया. अब कितने घर वाले बैठ के, see, you don't look at it as that I cannot meet outsiders, you look at it as that I can spend more time with my family, I can cook for my family, I can watch a film with my family. I know it's sounding hypothetical, but when you put your mind to doing it, you'll realize how much fun you'll derive out of it. So try and condition your brain to looking at the upper side of this, and this time will just go away. I don't know whether you would want to see this as funny or divine providence. One of my staff, actually what happened, जब शुरू कोरोना हुआ तब तक ओवरसीज पेशेंट्स सारे वापस नहीं गए थे. हमारी ओवरसीज फुटफॉल तभी भी चल रही. तो वन ऑफ द ओवरसीज पेशेंट्स, like I kind of felt she's uneasy. वो बोल नहीं रही थी, but I could see she's uneasy. So I told her to get a COVID testing done. So she got a COVID testing done and she turned out to be positive. Now I had seen her, one of the front desk girls. The only two people who came in contact were both of us, and the government machinery got into swing. They COVID tested me, they COVID tested her, and जब तक हमारी रिपोर्ट नहीं आई थी, that 48 hours we were asked to stay in quarantine. हम दोनों नेगेटिव आ गए तो we were back. अब ये 48 hours में हमारी क्लिनिक में 2 लोग ऐसे थे जिन्होंने हाय तौबा मचा दी कि जी हम बर्बाद हो गए, हम कोविड हो गए, हम ये हो गए, हम वो हो गए, हम नहीं, मेरे घर में बच्चे हैं, मेरे घर में बूढ़े हैं. मैं भी बड़ी शांति से उनकी बात सुनती रही. मैंने कहा भैया अगर आप इतने परेशान हो रहे हो, आप घर रुक जाओ, 14 days क्वारंटाइन हो जाओ, उसके बाद लौट आना. अच्छा, अल्टीमेटली 2 दिन में वो 2 दिन पे वो दोनों छुट्टी चले गए, which was fine. अच्छा, फिर 2 दिन में फॉर्चुनेटली हम दोनों पॉजिटिव से, मतलब हम नेगेटिव आए तो शांति हो गई उनको कि चलो वो तो ये तो दोनों मिले थे, इनको कुछ नहीं हुआ, हम मिले नहीं तो हमें भी नहीं होगा, एंड थिंग्स सेटल. अब 4 नहीं 5 दिन निकले, उन दोनों के घर कंटेनमेंट जोन में आ गए और उनके घरों के आगे वो लग गए फट्टे. अब उनके यहाँ फटे लगे, देन they were like कि अब हम क्या करें. ऐसे क्या करना है, उठो, talk to the police वाला there. If they want any written note from us, we'll give you a written note. Your healthcare employees, they'll let you come. और नहीं तो show your I card. So when they came back, they told me कि दीदी हमने, most of my staff calls me दीदी, some call me ma'am, some से दीदी हमने इतना ड्रामा किया आपके साथ और आपने हमें काम पे वापस बुला लिया. तो मैंने कहा, you see, this is just providence. Yeah, this was God's way of letting you know कि this could happen. 30 people तुम्हारे घर के आसपास, 30 people तुम्हारे घर के आसपास, और तुम्हें नहीं हुआ ना, तो तुम्हें आगे भी कुछ नहीं होगा. So I mean, I don't know whether to call it funny or whether not to call it funny, but इतना ड्रामा at 48 hours, they were on my case. They would come pump down my husband. मैम देखो पागल हो गई है, हम सबको भी रिस्क पे डाली, सर आपको भी रिस्क पे डाल रही हैं. कितने लोगों को इन्होंने समझाया, पट्टियां पढ़ाई, सब कुछ करा, but which was okay. We understood कि ठीक है, they are also stressed. हमारे घर में बच्चे हैं, अरे भैया एक मरीज, वो भी बेचारी मास्क पहन के आई हुई, मतलब she looked uneasy. तो मैंने, मेरी भी बेवकूफी कह लो या अकलमंदी कह लो कि मैंने उसका टेस्ट करा लिया. So I mean these kind of incidents keep happening. अच्छा, अब वो फर्स्ट थी तो हमें थोड़ा जिटरी हुआ. अब now everybody takes it in their stride. अब तो ये लगता है कि कोई खांस रहा है तो उसको पहले दिखा दो कि वो कम से कम और पेशेंट्स को ना कंटामिनेट करे.